timing for surgery. When do we decide to do cataract surgery? So a term that I don't like to use the term cataract surgery. A better term to use, or that we use these days, is called custom lens replacement, because you are actually replacing the lens, and you can actually decide what type of lens you want to use depending on the patient's lifestyle and needs, as well as the eye itself. So timing of cataract surgery, I divide it in two groups. Okay, the most common group is patients that find that their vision is affected with their glasses. So they were wearing glasses, and they were happy with their glasses, and they went to the optometrist, and the optometrist, like, because they can't see that so well, and when the optometrist tests, they find that they just can't get a clear image. And so the optometrists know that when they're going to prescribe glasses for this patient, he will still not be happy because there's an opacity within the eye. So that's the correct timing, like for surgery. When the patient feels that their daily activities is affected, and they can't get clear vision with their glasses. So if we see, for instance, a patient, and often like an ophthalmologist or an optometrist will say, I can see there's a cataract, but the patient is happy with their vision. They feel that they're functional, then you're not going to operate for that specific reason. And we will wait, and the surgery is actually determined by the patient in most instances. Then the other reason for doing cataract surgery or custom lens replacement is when a patient comes and see us in the practice and they say, I don't want to wear glasses. Often these patients will come for laser vision correction, and when we examine this patient, we find actually that there is a cataract, and that if we're going to do laser vision correction within a year or two, that cataract might be so significant that we have to do a lens replacement. So makes much more sense addressing the refractive error or the spectacle error with custom lens replacement and using a lens for this patient, so that, or this procedure, to give the patient spectacle independence. It is important to note, though, that this is an refractive procedure or a lifestyle procedure, and that this is not covered by medical aid because we're not addressing a physical disease in the eye like a cataract. The cataract is not so significant that it is actually causing functional vision loss. Whereas if the cataract is significant enough to cause functional vision loss, it is affecting the patient's daily activities, even if they wear glasses, that is normally covered by a medical aid.